As I mentioned, my name is Jess Hegstrom. I'm the Suicide Prevention Coordinator for Lewis and Clark Public Health. I'm joined by Julie Burr, who is our Connect Referral Coordinator, and Sarah Sandow, who is the Lewis and Clark Public Health Prevention Team Supervisor, who will be monitoring the chat as we go along. So let me go ahead and share my screen, and I will tell you a little bit about what we're doing today. Here we go. Can everyone see my screen?
Yep.
Thank you. All right. So we are holding this event in honor of Suicide Prevention Month. We want to make sure that our community is aware of resources and projects that are occurring in the county that they can learn about and also use. So today we're going to start by doing some presentations with myself, and then Kara Hughes from the Connect Referral System, John Tabb from Montana Department of Public Health and Human Services, who will be talking about the Suicide Prevention Lifeline and how it is being turned into a 3-digit number. Excellent news. We will hear from Jessica Gruber from the Center for Mental Health, who will talk about the survivors of suicide attempt support groups that are offered through the center. And then we'll finish up with Jason McNeese, who is with Breathe, Let's Start a Conversation, which is a suicide bereavement support group for people who've lost someone to suicide. So to get started, first thing I want to mention to all of you, it would help if I actually had this in. Hold on. I'm having issues. Okay, can everyone see the slideshow or just my other screen?
We see the slideshow just in the not presentation form, but just we see the slides.
Okay, sounds good. Let me fix that. My apologies, everyone. I'm having difficulties. Nope, that still didn't work. All right, can everyone see that?
We see your background.
Okay, let me stop one more time.
It's a pretty one, though.
Oh, thank you. All right, let me try one more time. Okay, and then let me. Okay, is that better?
Yes, that looks great.
Awesome. All right. Sorry, everyone. Okay. So first thing I want to talk about is it is Suicide Prevention Month starting today. So we have a whole calendar of activities that are being put on partially through Lewis and Clark Public Health and a lot through other agencies that we are partnering with. So please do visit lcsuicideprevention.org, upcoming training opportunities, and we'll drop that link into the chat box. But you can see a bunch of different things that are happening. We have training. There is the NAMI walk on Sunday, September 19th. There is St. Peter's Health's coffee break on the Monday, September 20th, where you can get $2 off a coffee at $18.89 and learn about some of their programming. And there's a bunch of other stuff that's happening. So please do take a look at that website and see what we've have going on. And you are welcome to attend any of it. And tomorrow morning at 9 a.m. at the Board of County Commissioners, we will be hearing a Suicide Prevention Month proclamation. So if anyone would like to attend, that's at 9 a.m. at the City County building on the 3rd floor. So to get started, as I mentioned, I'm the Suicide Prevention Coordinator, and I'm going to talk to you a little bit about some of the stuff that we do and some resources that are available to you. So Lewis and Clark Public Health Suicide Prevention Program is under a 3-year grant from the Substance Abuse Mental Health Services Administration that actually sunsets at the end of this month. But we are looking at potentially getting another grant continuation starting in October. So cross your fingers and toes. That should be happening very soon. But through the grants, we offer free evidence-based education for our community. It's really about making sure that everyone in our community has the ability to recognize warning signs and knows how to act and help others to prevent suicide. We don't want anyone falling through the cracks, and that happens often. And by educating ourselves, we can help prevent that. And really my goal in our communities is to get at least 25% of the population trained in QPR, which is our most basic education, so that people can, again, recognize when someone's struggling and get them to the help that they need. It is a really basic first aid course. We also offer youth mental health first aid, which is an 8-hour training in person or 6.5 hours virtually. And that really helps adults tell the difference between what is normal adolescent development and what is a burgeoning mental health challenge, because it's really hard for adults to tell the difference. But we also know that 50% of all mental health challenges onset around the age of 14, 75% by the age of 24. And we know if youth get the help that they need early, that they're just going to have a much better life. They're going to have strategies to deal with the mental health challenge. If they do in fact have a disorder, they'll get treatment, they'll get support, and we want to make sure that they get that as soon as possible. Most people don't get diagnosed till their late 20s, early 30s. So this training is about cutting all of that out and getting people help now, especially our youth. Sorry, it just clicked that. We also offer applied suicide intervention skills training, ASSIST, which is a 15-hour training, and we do that in partnership often with Fort Harrison. We have a new program that we're rolling out called CALM, Counseling on Access to Lethal Means. It's not our model, but it is something we're offering to the community, especially providers, because it helps people have that conversation about what to do with medication and firearms if someone in a household is identified as struggling. And it's really about working with that individual to find someone they can trust who can hold on to those things, and also locking them up so they're safe storage. Adverse childhood experiences, we do this in partnership with Elevate Montana Helena affiliate. So it's teaching people about ACEs. So ACEs, as I said, are adverse childhood experiences. And if someone has 4 or more ACEs, they're supposed to be more susceptible, more likely to have diabetes, obesity, a variety of other problems, mental health challenges as a result of these experiences. But we also know that if you have one trusted adult during your youth who is your rock, who's solid, then that person can help you navigate the waters of adolescence, and you're just more likely to have a better life. So adversity is not destiny. And then finally, we do a training called Military Strong. It's military cultural competency, which I'll talk about in a little bit. But you should know all of the training we offer does fall, except for Military Strong, does provide CEUs for behavioral health professionals to meet their Department of Labor and Industry requirements that have been recently set. The CEUs are also good for law enforcement and a variety of other careers. So if you're interested in learning more about that, please let us know. Next thing I want to mention is we have a partnership with this really excellent organization called the Awareness Network. So what you should know about the Awareness Network is that, one, they provide scholarships for youth for mental health services. So if there's a kiddo in your life, or you know someone who has a young person who's struggling with their mental health, Awareness Network will provide a scholarship for them to receive services if their family is uninsured or underinsured or wants to try something experimental. So that is a way to reduce barriers to access. They will help. They help up to the age of 25 years old, and they're underutilized. So please, if you know someone who could benefit, do access their website. It's awarenessnetwork.org, and you can just apply for a scholarship online. And they're, as I said, they're a really excellent partner, because in addition to providing their scholarships, they also offer $5 gift cards for our community participants who attend our training. So if you come to QPR virtually or in person, you finish the training, you fill out some evaluation paperwork, you are eligible to receive a $5 gift card. And if you can't do QPR multiple multiple times and keep getting $5 gift cards, but you could do QPR, youth mental health first aid, the adult version, assist, and just keep getting those cards while really increasing your knowledge so that you can be a lifesaver. And the truth is that any of us can be a lifesaver. So we want to make sure that you have the education to help each other. And we also have some upcoming virtual training, just so you know. Amazing Brains, Understanding ACEs, Stress and Resilience is on September 9th. You register via Elevate Montana Helen Affiliate at Gmail, and we will share these slides with you after the meeting. There is a QPR training that's virtual on Thursday, September 16th at 5:30 p.m. That's the link right there. And then we also have another one, sorry, it's at 11:30 a.m. with St. Peter's Health. And there's the link for that. And I'll make sure to correct that before I send out those slides. And then on September 22nd, we are doing a youth mental health first aid training virtually. If you are interested, please sign up by September 15th so that we can share the self-paced training that is involved in this training. There's 2 hours of self-paced education, and then the rest will be facilitated virtually. So please take advantage of this training. It is really helpful for adults to tell the difference between those two things that I mentioned, adolescence and mental health challenges. 86% of parents who lost a kiddo to suicide weren't able to recognize that their kiddo was dealing with depression. So we want to make sure that we have the ability to recognize things early, not only for better life outcomes, but also because they present differently in youth than they do with adults in terms of mental disorders. So for example, depression often shows itself as anger and irritability in adult males and youth rather than just appearing like sadness. And you'll learn more about that. Also wanted to mention some of our resources available. As I mentioned, John Tabb will go in depth about the 988 Suicide Prevention Lifeline. Right now, the number is 1-800-273-8255 or 1-800-273-TALK. Dial 1 to reach the Veterans Crisis Line. The Lifeline is there for you. If you are personally struggling, if you want advice on how to help someone you care about, or if you are literally sitting next to that person, you can call the Lifeline and they will help you help them. You are never, ever alone. And honestly, if the best you can do is ask someone if they're thinking about suicide, get an answer, and then call the Lifeline, you're a lifesaver and you deserve a gold star for sure. We also have the crisis text line. You text MT to 741-741, and they have available crisis counselors, not just for suicide. They help with a variety of crises and will help the individual who is responding to them calm down, cool down. Both of those numbers are available 24/7. There's also the Trevor Project, which is for LGBTQ youth, also a crisis line, and the Trans Lifeline for people who are trans. We also have the Mental Health Crisis Recovery Line, which is for individuals struggling with their mental health as a result of the COVID situation. And then the Montana Warm Line for anyone dealing with a mental health challenge. The hours are shortened, but it is good to talk to other people experiencing these issues. And then also I wanted to mention the services from the National Alliance for Mental Illness. So NAMI does provide a variety of support groups and education around mental health. One that we find to be incredibly helpful is Family to Family. What it is, it's 8 weeks of education. I believe it's 1 hour a week, in which individuals who have someone in their household or family who's struggling with their mental health, they get to learn about prevalent mental health challenges, problem solving skills, and how to really be a good advocate for the person in their family who's struggling. They also have a support group that is attached that's also called Family to Family, and gives families the opportunity to talk about what they're dealing with, find strategies and solutions, and really just to be able to share what they're going through. So really quite an excellent service, and we will provide a handout with more information. Going back to the training conversation, so one of the major efforts here at Lewis and Clark Public Health is to reduce suicide among our service members, veterans, and their families. So one way that we're doing that is through a training called Military Strong. So it is an organizational training. So if your business, your nonprofit, whatever organization you're with wants to take this training, what happens is you sign up, and then we get you set up with a virtual link because it's all self-paced. And then you have 50% or more of your staff take the training. So it consists of 5 modules on military culture and suicide intervention. And then once you've reached that 50% mark, your organization would be considered military strong. You get a bunch of certificates and stickers and other recognition for participating. But even more importantly, it'll allow your staff to be able to better support and wrap your arms around our service members, veterans, and their families, which we have quite a lot of because we have Fort Harrison and the VA in our backyard, and about 11% of our population is just veterans. That's not accounting for people who are currently in the Guard or any of their family members. So we certainly have a veteran community, but we also, and military community, but we also know that we don't necessarily have the best cultural awareness in the community in general about how to serve them better. So this is a really great training. It takes an hour and 23 minutes to complete, and a lot of people really enjoy it. So if you're interested, please let me know, and my contact information is at the end of the slideshow. Another thing to be aware of is we do have a project that is has already rolled out called Safer Communities Montana. You may have heard some of our radio advertising, but it's really working with the firearm and pharmaceutical communities to prevent access to lethal means by people who are at risk. What that means is safe storage, and also talking to the person about how we can keep them safe for now. So examples are making sure they have a gun lock so that their firearms are locked up so that they don't have immediate access. That could be disposing of leftover medication that is just hanging around in your house, which a lot of people have. And so the goal of this program is to act as a pilot for the state and really just to make our community safer through safe storage. And as I said, we're working really closely with our partners with the firearm and pharmaceutical communities to make sure we get this right, because firearms are a part of the fabric that makes Montana, Montana, and we absolutely respect that, but we also want to make sure that families are safe. So we simply ask that those items are locked up when they're not in use. And if you want to learn more about the project, happy to let you know. We're also providing tip sheets to firearm dealers, range operators, pawn shops, and pharmacists to recognize warning signs among people who come to their counters and to slow down sales if they're worried about the individual, so they know how to react. And then we also have posters, postcards, and walk cards geared toward the public. All of those are on our website. If you want some, you can definitely contact us at safercommunitiesmontana.org, and you can sign up for gun locks. You can get other information from us and also share resources out in the community, because we need to do this together. That's how we prevent suicide. It takes a village. As I mentioned, we're giving out gun locks. We also have Deterra, which are drug deactivation systems that we are happy to hand out. We are doing a multimedia campaign, as I mentioned. We're doing radio, we're doing social media, and we also received some more funds, so we were planning on expanding out into broadcast television. We're also giving QPR and comm training for our community providers and our firearm dealers and pharmacists. And we also are working with an AmeriCorps Vista to help move this project forward. Here's an example of some of the postcards we have. And wallet cards. All of these are just about making sure people understand that locking up their firearms and medication does save lives. And if you do want to learn more about SCM, you can contact Carolyn Patterson, our Vista here, or you can contact me and I'll make sure to get this information into the chat. So just so you know, we're going to be reserving questions for the end of the presentation, but if you have questions, you are welcome to share them in the chat box. So next we are going to have Kara Hughes from the Connect Referral System talk a little bit about that program. Kara, I believe you have access to sharing your screen at this point.
I believe I do. That was a great, very informative presentation, Jess.
Thank you.
It's saying that I'm not allowed to share my screen.
Try now.
Okay, that might help. Okay. Great. Are you guys seeing my slides?
Yes, we are.
Okay. Give me 1 minute. So, hello everyone. Thank you for having me today. My name is Kara Hughes and I am one of 2 Connect coordinators in the Chronic Disease Bureau at the State Health Department. I'm sitting in today for Julie Burr, but she is your local contact, and I will share her information as well as mine at the end of the presentation. So let's jump in. So today I'm going to talk about the Connect bidirectional referral system. It's a great platform for any of you guys to use to refer clients out or see referrals in. And I know that some of you may be aware of this or have worked with Julie or have heard this presentation before, but for those of you that haven't, that is why I'm on today. So what is the ultimate goal of Connect? The ultimate goal of Connect is really to foster a collaborative culture among providers and social services or community-based organizations in Montana, and really improve the referral process overall by establishing accountability and improving processes for the exchange of client information. It's really meant to get Montanans to the services that they need and make sure that everyone's remaining accountable throughout the referral process. So Connect is a provider-to-provider referral tool meant to close the loop in care coordination. Providers are able to work together in a more efficient manner to get the client information that they need and then track the outcomes of those referrals. So for example, provider A can refer a client or patient over to provider B. That provider B could be a community organization or social service as well, just to clarify, but can send a client over to provider B and share the pertinent information about that individual. Then provider B can utilize the system's tracking capabilities to let provider A know, one, the status of the referral, any recommendations that result from the referral, and then next steps. It's really a two-way loop in communication. So some more basics of what Connect is. It's a secure web-based system for, as I mentioned, sending, receiving, and tracking referrals. So if you have an account in Connect and you have access to the internet, you can access Connect. It's all via a link. And it's an interconnected statewide network. So it allows providers to make referrals not only in their home community, but from their home community to anywhere across the state on behalf of the client. And then referrals can then be made back to the client's home community for follow-up and support services if necessary. And what's really unique about this platform is it's accessible by any type of service provider. As I said, provider is kind of an overarching term, but that's really inclusive of everything from medical providers to community-based organizations such as food banks, eligibility programs, anything that you can think of. If they offer a direct service, they can be in the Connect system. And it's scalable, which is really nice. So it works just as well for an independent LCPC that does everything, including sending referrals out, as it does for a larger organization such as a hospital that has many different layers to it, and the referral process is a lot more complex. And it is FERPA, HIPAA, 42 CFR, and IDA compliant. It's been vetted multiple times, not only at the local level, but at the state level. And we're actually going to do another vet of the system for looking at all of the new enhancements and upgrades we've done to it, ensuring that it remains compliant of all these privacy laws and statutes. And unlike some other platforms you may be familiar with, it's available at no cost. So since starting the statewide expansion in 2019, the Chronic Disease Bureau at the State Health Department picked up the user fee. And so anyone that wants to participate in Connect, there's no cost at all. And then there's a number of reports available in the system that really demonstrate what's going on with your incoming and outgoing referrals. So it gives you kind of a larger picture of what's going on in that process for your organization. We found that this has been very helpful for organizations that are trying to improve their referral process and just do overall quality improvement within their organization. So we always touch on this, what is Connect not? Connect is not a case management system, an electronic medical record or electronic health record, and it's not a health information transfer system. The core of what Connect is, and at the very heart of it, is that providers work amongst each other to get the information they need from a client. So it's not a replacement for human interaction. We still expect that provider A and provider B work together to get that information, whether it's via fax or some other secure format. And it's not time consuming. So those of you that maybe have seen the demo in the past or would like one in the future, I know Julie's always sharing that and providing demos. You can see that it only takes a few minutes to send or receive a referral, as well as make any updates to that referral status. And it's not complicated. So not only is it pretty user-friendly, but we have a wizard tool that walks you through step-by-step of how to send and receive referrals. You'll also find a user guide within the system. And you can also contact your local person if you need help, if you're struggling with how to send a referral, for example. So I'm showing this map broken up into 14 health regions. This is how the Chronic Disease Bureau breaks up the map of Montana. And so within that, we've hired local coordinators at the health departments to not only work on the expansion of the Connect system in their county, but the surrounding counties as well. So they're meeting with stakeholder groups, different coalition members, providers, and community-based organizations to create buy-in, get them trained and onboarded on the system, and then gauge where their current referral process is and where Connect fits in. And so beyond the coordinators at the health department, like Julie, we hired 17 prevention specialists through the Addictive and Mental Disorders Division at DPHHS that help our coordinators at the health departments with onboarding and training individuals, but they're more focused on getting programs that address substance abuse and mental health providers on. And then actually, sorry, this slide is not updated. We just actually hired a few more, but we have 5 NASPA coordinators that work in higher ed. So in a variety of colleges across the state that also work as regional coordinators in a sense, but they're focused on getting school resources on and family resources on Connect. So who is using Connect? As you can see here on the slide, it's a variety of services. And as I mentioned earlier, if you offer a direct service, you can be on the Connect system. So it's inclusive of everything from youth organizations to substance use programs, food pantries, medical providers, etc. And it continues to grow. We have over 400 programs on currently and over 1,100 users of the system. And I will say that Julie's been doing a really great job kind of honing in on getting more mental health providers on and creating more of a robust system where right now it's very hard, I think, across Montana to find counselors or psychiatrists and see who has a waiting list, who's taking new clients, what exactly is going on. And within Connect, you can do that. So if you are a therapist or a counselor or a certain resource, and maybe you're at capacity, you're able to toggle certain features on and off the system to show clients or other providers that. But like I said, Julie's really focusing on getting those types of services on. So I put up here our website, and I'll type it in the chat as well. But I highly suggest for anyone that's interested to go to connectmontana.org, and you can find more about the system, who's on the system, who your local coordinator is, etc. And then I put both Julie and my contact information. Again, Julie is your support at the local level. And then if you have any other questions for me or questions about the statewide expansion, you can reach me at connectmt.gov. Thanks. I know we're saving questions for the end and I do have to jump off early, but I'll check out the chat and see if I can answer anything. And if anything else comes up, please feel free to contact me at that email or Julie.
Great, thank you, Kara. Next up is John Tabb with the State Department of Public Health and Human Services. John, you should be able to share your screen, so go ahead.
Great, thanks. Just a second here. All right, can everybody see that?
Yep.
Great. All right, everybody. So my name is John Tabb. I'm a suicide prevention specialist with Carl Roston here at the state, DPHHS. And my particular area of focus right now and for the last 6 months has been on the implementation of the 988 Lifeline transition, put it that way. As just said up front, we've been working with a 10-digit Lifeline number, national Lifeline number, for a while now, and Congress passed the National Suicide Hotline Designation Act in 2020, which was about switching over to a 988 number to replace that. The idea being that we have a 3-digit number for medical emergencies and law enforcement emergencies, 911. So we should have a similar type number. They wrangled over what those 3 digits should be and arrived at 988 being the one for mental health crisis and suicide prevention. So obviously, that seems like a straightforward switch, but there are actually a lot of things that go with that. Vibrant Emotional Health was given the national grant for implementation. And with that grant, there were a number of tasks they had to get accomplished and help states get accomplished to implement, because Congress didn't authorize funding, for example. And so it was really kind of like, hey, go forward and do great things, but figure it out on your own. So they offered that grant down to the state level and initiated an implementation period, planning period that we're in the middle of right now. When they gave us the grant, they gave us 8 core planning considerations that we had to use for planning. And the planning period initially was 1 February to 30 September 2021. Because of different states being at different levels, moving forward together, they extended that out to accommodate some states that were a little bit further behind. So our deadline for the planning period is now going to be in January, with a draft of the plan due on 30 September. So we're still, having to hurry up and get it ready to go, but we've got a little more time to think about it. The 8 core planning considerations were 24/7 statewide coverage, strategies for supporting funding streams, because as I said, Congress didn't have funding go with the legislation. Building capacity to handle the expected increases in call volume, operational clinical performance standards, basically a review of that to make sure that every, the crisis call centers are in accredited standards, have an accredited standard of that nature. The implementation of a 988 coalition of stakeholders. So we've been doing that for about the last 4 months, where we bring together stakeholders in the crisis management community and give them an opportunity to be updated on the process of 988 and then to provide input as the planning initiative goes forward. A local resource and referral listing is a requirement. Follow-up services provided by the call centers, and then consistency in public messaging once we roll out 988 to replace the 10-digit lifeline. Now, we're fortunate here in Montana because we have 3 crisis call centers that have been operating for a while now. They are nonprofits and are currently handling Lifeline calls in addition to other network calls at the rate that the Vibrant contract or the Vibrant grant requires. So that's 90% call handling in state, and they are currently managing that. For up until about 4 months ago, we had only 2 call centers. We had Voices of Hope in Great Falls and the Help Center out of Bozeman. But now Western Montana Mental Health has added a call center to cover the Missoula area and some surrounding counties. So that increases our call handling ability regionally, because that's the aspiration. So you can see that down below in each one of these, what numbers they handle, what calls they field. So in addition to Lifeline, they also field 211 calls, and then just calls that are made to their local number as well. Now, as I said, they cover the state entirely, and this map shows you where that geographic distribution is. The network, the Lifeline network, is designed so that there's redundancy, so they're backup systems. So if the call center that has responsibility for one of these counties can't field the call, then it's routed to the next layer of backup, which is at the state level. So potentially if Voices of Hope can't field a call, the Help Center would be next and so forth. If it can't be fielded within the state, then it goes to a national backup network. And in those instances, the call could be answered anywhere. Could be in Florida, could be in New York. Obviously, that's not optimal. Anecdotally, and research has shown is the more regional, the more local the call can be answered, the higher likelihood of a good outcome. So again, because we have a 90% or better answer rate, we've been doing pretty well already, and that means that we're further ahead than a lot of states are. All right, 24/7 coverage. I said we're already there. We expect a 30% plus or minus increase in call volume with 988. Right now, it looks like the call centers as is will be able to handle that volume. If not, then we have plans in the works to get their staffs increased, both in FTEs and then volunteers. Like so many areas of the economy right now, it's difficult to find people though. And so, especially in the case of Western Montana, they're having a little bit of difficulty finding folks to apply for those positions. And that may prove to be a challenge going forward. If you call 988 today, if you're a Verizon or an AT&T customer, your call will be routed to the existing 10-digit Lifeline service. So technically speaking, it's already operational. All right, the coalition, as I said, we've already started it, and the next meeting will be on September 7th. We're pretty much leaving the invitation open to those who feel like they have a stake in what we're doing in this planning. But mainly we're focused on folks that are involved in crisis call centers, referral services, mobile crisis response, crisis stabilization facilities, and then just interested community partners. That big group, as I call it, we also have a small working group that's associated with it, is there to get an update and hear voices from other states that are doing certain aspects of this right, and making some progress with it, and also to give them the opportunity to give us a little bit of feedback in order to integrate into the planning. And basically what I just said. Okay, so in local referral lists, and Kara, it was good to hear from you today because I've been educating myself on what there is for referral systems in the state. And right now, the call centers, all three of them, use Montana 211 as their primary referral listing because it's integrated with what their application, which is called iCarol, their call fielding application in it. And 211 is already built into drop downs there. So that's their system of record currently. And it's not obviously the only referral system in the state, but it's the one that the crisis centers currently use. And it covers 36 of 56 counties in Montana. That's very shortly here going to cover all 56. It's been some things with local entities that have had to be worked out, but now up in Flathead County was kind of the last one. That area was the last holdout. So we'll be covering all 56 counties with 211 through the crisis call centers very shortly. All right, so goals for our implementation. The biggest piece of it is enhancing integration of crisis management across the state. So we see 988 as a catalyst for doing a better job of crisis management mapping by county throughout the state. When we started this process, we realized that there was a disconnect between what the call centers were doing and some of the growing crisis response assets in certain areas, especially in the urban areas. So the mobile crisis teams are a relatively new initiative, making sure that they are part of the dispatch process, so that ideally we get to the point where a strictly mental health crisis call is fielded by a crisis call center, which dispatches directly to a mobile crisis unit, which takes an individual to a stable point of stabilization, and is plugged in so that we have what we call air traffic control level of coordination. So from the moment the call is made to the time the crisis is stabilized, there's constant contact between the person in crisis and the resources along that chain. So that's the goal. That's what I've said here. All right, and pending any questions at the end, that concludes my presentation.
Thank you, John. All right, so next up is Jessica Gruber from the Center for Mental Health, who will share about the Survivors of Suicide Attempts support group at the center. Jessica, do you have access to share at this point, or do we need to add you as a co-host?
No, I actually don't have any slides to share. I just wanted to talk to you guys today. So mine's going to be somewhat simple and fairly brief. I guess I'll give you a little bit of a history. So I'm Jessica Gruber. I work as an outpatient therapist at the Center for Mental Health. I've been there for about 7 years now, and I've worked both in the Helena office, then I worked in the Townsend office for 4 years, and now I'm additionally working in the Boulder office. So when people speak to the struggles of rural healthcare and mental health care in general, there are so many barriers, and it is so hard for communities that we're really trying to tear down those barriers. Recently, the Boulder Monitor came out with an article today, a young lady named Aleka. She's doing, I think it's a 5 or 6 part series on mental health, and she's writing excellent articles. The one today was specifically on the suicide rates with farmers and ranchers. And it was a really excellent article, and it really spoke to the kind of ingrained mentality of keeping everything inside and not being able to talk about anything. And it gave some additional resources. The woman who lost a family member to suicide, who was a rancher, she started a foundation called Ask for Ernest, or Ernest to Ask. Let me look real quick. Anyways, it's a foundation that specifically has resources for suicide help that are more rancher and farmer friendly. It's called Ask in Earnest. And on that website, they have all the same resources that we all talk about here, but additionally, they have resources like the farmcrisis.org and some additional resources that are more farm or rancher friendly. So rural care for me, I've got a real soft spot for it. Anyways, so as I talk about that, I also have, obviously working in this field, a soft spot for people who really feel there's a huge stigma in talking about suicide attempts, and suicide thoughts. With that being said, it was in 2018 that I did the Survivor of Suicide Attempts group training. The training was put on by D.D. Hirsch Foundation, which is a mental health center widely known in Los Angeles, California. The program itself, the SOSA group itself, it's a cognitive behavioral group, and it is very well respected and widely known. Over 1,500 different mental health facilities in the nation use this group and this model in over 35 countries. The group itself is, it's an 8-week group, and it is an hour and a half per group. The groups usually start from, like the smallest group I'll do is 6 people, and the largest group I'll do is 8, sometimes 10. It's a very intimate group, and it's a closed group. So once it gets started, it's closed, but then you can join in on the next cycle. For the reason we keep it closed, for somewhat obvious reasons, it's very intimate, personal stories people are sharing. And so keeping it closed kind of keeps a very safe room and keeps a very safe group. So when I started the group initially and did my first group, it was pre-COVID, and it was excellent. It was a beautiful group. And people responded to it really well. Everybody was really apprehensive. It's, you know, when it comes to groups, people are really somewhat afraid to begin with, just because socializing with a group of people you don't know about mental health in itself can be really intimidating, right? And anxiety provoking. But once they kind of settled in, and once they started hearing stories from other people who had gone through attempts and connected with people in that way and got validated for what they were feeling in their thoughts, and went, oh, me too. It was really a connected piece where not only were they able to open up and share about what they were thinking, but they were able to destigmatize their thoughts. They were able to get other supports in the community, and they were able to learn coping strategies, including what your triggers are, what's a safety plan. What does it mean to give and receive support? What are the pros and cons of that? What are your resources out there that you guys provide and the nation as a whole provides? And then, you know, the group ends essentially with the hope box and what they look forward to moving forward. And also they can repeat the group if they want. They can do it many times. So I'm starting the group back up again. And in COVID times, here we are still. And I do have a space that's big enough to keep the social distance. And if need be, I am going to offer it via Zoom as well, because what I have found out throughout COVID is that even though Zoom might not be people's preferred form of therapy or treatment, at this point, people have been in quarantine to some degree for so long that they're wanting at least some connection, even if it is via Zoom. So with that being said, I can ramble, so I apologize if I digress. If you have questions, definitely chime in, or at the end, ask me. The group itself, the only requirement, we have a couple of requirements. The first one is that you do have to come to the Center for Mental Health and fill out an application and just go through an initial mental health evaluation. After that, you can just do the group. You don't have to utilize any other services. And the group, the only prerequisite for the group that in addition to doing the mental health evaluation is that they have had to have attempted suicide at least one time. Right now, the group is co-ed, but it is 18 and over. So I do not do a group for teens or children at this point. With that being said, I think that's kind of the gist of it. I really just wanted to present that that group is available and that I'm starting it back up again. And so far I've got about 5 people committed to doing it. And so I'm looking for a few more, and I'll do it for 8 weeks. And then once the 8 weeks is up, I'll recycle through it again. So it's an excellent group. The first group just goes over the structure of the group and what it's going to look like. The second week would go over basically watching videos of other people that have attempted suicide and sharing their stories and open up that dialogue. Then it goes over the pros and cons of giving and receiving supports. Then the next week goes over what your triggers are, including doing a safety plan and looking at negative thought patterns. And then we go over resources and hope. In each group, there's definitely like a warm up in terms of being able to talk about words to describe yourself. And if they go down the negative route, we always try to balance out with the positive, right? And then at the ending of the group, we do some kind of ending exercise, and it's whatever they want to do, whether it be like a one-word check-in or some kind of stretch or some kind of random noise, or if they want to share an object or a song or something to that extent. So that is the group in a short amount of time. And then if you guys have any questions, I'll be on here until the end. But it's a powerful group, and I'm very passionate about groups. I love doing groups. And we're definitely open to the public, and we'll see all insurances. So the biggest thing is just getting them in to do a mental health evaluation, and then they can get started with the group. And yeah, I think I went over everything I wanted to say today.
I love it. Thank you, Jessica.
Yeah.
If you wouldn't mind, if there's a way for people to get onboarded, like if there's contact info, do you mind throwing that in the chat box?
Yeah, absolutely. Yes.
Thank you. All right, so next up is Jason McNeese. He's with Breathe. Let's Start a Conversation. He is also a certified behavioral health peer support specialist, and he's going to tell us about the suicide bereavement support group here in Lewis and Clark County. Jason, did you have any slides you wanted to share?
I don't have anything really to share on the screen. No, thank you.
Okay, well, take it away.
Cool. Thanks, Jess. It's good to see you. Yeah, my name is Jason McNeese. I'm a behavioral health peer support specialist at the Helena Indian Alliance Leo Pocha Clinic. Outside of that, and in my free time, I used to work closely with Abby Calusi, who has moved out of state. She's no longer with us, which is really sad. And I've taken over as the primary facilitator for Breathe. Breathe is a suicide bereavement support group in cooperation with St. Peter's Hospital. So we have worked, in coordination with Jess over the, course of the last several years, both with QPR and a little bit with lost teams. We meet on the 4th Tuesday of every month at St. Peter's Health. And it's really just a support group. So kind of ebbs and flows the number of people that we have in attendance. It's open to everybody. So both those that are suffering from with grief after suicide loss, or individuals that may be struggling with a suicide attempt. Our information is available both on Facebook and Instagram. So we kind of just post our support group meetings on there, so you can follow us The Facebook link is free. Let's start a conversation. Or you're also welcome to email me and I can just put that information in the chat. That is all I really have, Jess. I don't have a whole lot more.
Do you mind sharing a little bit about what those support groups look like and what you guys do during your hour?
Yeah, so we just it's really just a conversation group. So it's, you know, similar to you know, peer support group where it's really just conversation. There isn't any specific curriculum.
Great. And it's for people 18 years old or older.
Yep.
Okay.
Yeah.
Great. Awesome. All right. So that is on the 4th Tuesday of every month in St. Peter's Health in the admin building.
Yes, it's directly across from the ER is kind of where the, well, no, directly across from the North Clinic is where that would be at.
Great. All right. Thank you, Jason. So one thing I wanted to add, in addition to the suicide bereavement support group, we know that people who've lost someone to suicide are at a greater risk of having suicidal thoughts themselves, possibly making an attempt. We also know that they're more likely to adopt unhealthy behaviors as a way to cope with the loss of a loved one, because suicide grief is incredibly complex. So if you've lost someone to suicide, the best suggestion we can give is to go ahead and try out this bereavement support group, try out some services. There are several grief counselors in town. Also, we work with an organization called the Tamarack Resource Center. They're in Missoula and several other areas around the state, but they do grief camps for kiddos. They have free support groups. And then of course, they also do therapeutic services. So really important that we get people that support, because when you lose someone to suicide, not only is it complex, but you often feel like you're alone. Because there's so much stigma around suicide, you don't necessarily feel like you can talk about these things with other people. And through the support group that Jason runs, people have that opportunity to talk about it and to figure out strategies and to realize that things will never be the way that they were, but you can reach a new normal. You can live a happy life despite this loss. And we want to help people who've lost someone to do that, and to, you know, be able to move on and be happy. So anyway, I really can't praise this support group more. Definitely something worth looking into if you've lost someone or know someone who has lost someone to suicide. So that is the presentation. So next thing is going to be questions. So do we have any questions for our presenters today? And if you want, feel free to just press your space bar to temporarily unmute yourself. Okay. Well, oh, go ahead.
This is Sarah. So first, nothing was in the chat leading up to this, but I have a question for Julia. I was wondering, are those classes open to people in towns in Jefferson County as well?
Do you mean Jessica?
Jessica, yes, sorry about that.
So the group itself is, yes, it's open to both Boulder and Townsend. However, they would have to come into Helena or come in via Zoom in order to do the group, as I don't have enough people to do a full group in Boulder, a full group in Townsend, and a full group in Helena. But yes, absolutely open. And the group is nice because it's a nice mix between conversation and being able to openly talk, plus skills and tools and kind of structure. So that's one beautiful thing about the group. It's a very good combination of both. But yes, absolutely open to Townsend and Boulder. And right now I'm working out of the St. James Medical Clinic in Boulder. So the referral system right now is very fluid and very nice. And I'm right in the same building as the public health department. So it's a nice marriage, if you will. So yes, it is. Long answer, but yes.
So Jessica, I'm wondering a little bit about like fees. I know you mentioned insurance. What if you don't have insurance and you want to get involved?
So that's a great question, and that is definitely a question I have asked my supervisors as well. Right now, what we're looking at is we do have some grant money, and so we're looking at being able to use that grant money in order to subsidize those who can't afford to pay for it out of pocket, or if the insurance doesn't cover it, right? Because not all, for instance, private insurances cover group sessions. Most of the time, Medicaid, not most of the time, Medicaid will cover group sessions. However, when we're looking at the various private insurance or VA insurances, it could be a little more difficult. So that is something that if there's a concern, definitely talk to me, and I can talk to my higher ups and see what money we can access to compensate for that.
So is that immediately available, or is there?
That is what I'm waiting for a response on. I know that the funds are there, just how we can use them and how they can be allocated. I'm waiting on a response on that.
Sounds good. Thank you for that.
Yes.
And then you said that they have to go into Center for Mental Health, fill out an application, and then get an evaluation. Can you tell us a little bit more about that process?
Yes. So a couple of thoughts had crossed my mind when I started this group. Originally, I was, sorry, I'm a face person. So originally I was wanting to be able to bypass that system. But to be honest with you, if I do have somebody coming into this particular group, because in the past I have done anger management groups and art therapy groups, but for this particular group, I would want to do a full mental health evaluation for somebody who has had at least one attempt or more. So I know exactly where they're at and what their history is. And so that when they're in the group dynamic, I have a very good understanding of their cues and their history. So that process looks like they can access the application either online, or they can go pick it up in person at the Helena 900 North Jackson address. And then once they do that, they will turn it into Linda. Linda will give it to me, and I'll schedule the intake. And I can do the intake via phone, I can do it via Zoom, or I can do it in person.
And then the website, is that centerformentalhealth.org, or is it something else?
Yep.
Okay.
Yep.
Awesome. Great. Thank you for being here, Jessica.
Yeah, thanks for having me.
Any other questions from our participants? Okay, well, I am not hearing any questions. So we will be sharing slides with you and some resource information, as Julie mentioned in the chat. But if you have any immediate questions that you just didn't want to share in the room, do feel free to email me, and I can get you directed to the right person. And I'm dropping my email back into the chat box. And there we go. So thank you so much for joining us. We look forward to seeing you at some of these Suicide Prevention Month events that are happening. And have a wonderful day. Thank you for joining us.
Thank you.
And thank you to our presenters.